but we don't see your eyes. If you want to move your camera.
All right. Well, thank you guys for joining us. This is our January Genetic Ambassador Call and continuation of our Serving on Groups training. I just want to do a little roll call, if that's okay with everybody, and do just a real short introductions, because I've got a full schedule for today for our call. So, but I want to make sure I've got everybody down that's on the call. So I'll go down my list and just call on you if you just want to just say who you are, where you're from, and how you got involved with Mountain States. That would be great. So Adrian, are you on? Do you want to introduce yourself?
Hi.
Yep, you're off mute. Good job.
All right. Hi, I'm Adrian. I'm from Colorado, and my son has a rare genetic disorder called 15q, and so I got introduced through Mountain States through Christy and the whole scholarship going.
Yeah, I was going to say you're a consumer scholarship winner for Genetic Summit. Awesome. Great. We're glad you're here. Susan, do you want to introduce yourself?
Yeah, I'm Susan Owens, and I've done autism research for about 25 years and am head of the Autism Oxalate Project. And my family also has a lot of exotic things that seem to be related to thiamine chemistry, and I'm chasing that like crazy.
Thanks, Susan. And you were a speaker at our Genetic Summit in last October. And
yes,
Mallory,
I've made a lot of progress since then.
And Mallory, are you there? Could you introduce yourself?
Yes. Can you hear me?
There you are. Yep, I can hear you.
Okay. My name is Mallory Fear, and I currently live in Denver, Colorado. I have a rare genetic disorder called microvillus inclusion disease. It's a GI condition that I've had my entire life. I used to live in Maine and then Boston, so I was involved in our regional New England Genetics Collaborative, bringing the consumer perspective and talking about transitioning healthcare from pediatric to the adult side while living with a chronic condition. And so after I got my master's in Boston, my now husband and I moved out to Colorado after attending some national genetics conferences. And so we got connected to the group out here.
Great. We're glad you're here. And congratulations, because I know you weren't at our genetic summit because you were getting married.
Correct. So priorities.
So congratulations. All right. And Jamie, are you on there? Could you introduce yourself?
There we go. So I'm Jamie Stefanski, and I have 2 children with the newly found condition and rare condition of Yu-Hooper-Fong, or TELO2. And I live in Colorado, and I'm on the Colorado State team for Mountain States.
Great. Thank you, Jamie. Glad you're here. And I've got Danelle. Are you there?
Yep. So I'm Danelle. I'm from Cheyenne, Wyoming. I have got 2 girls. My youngest one was just recently diagnosed with a rare genetic disorder on one of the GABA receptor genes. I'm still trying to learn all this information. But I got connected with Mountain States. It was probably like 2 or 3 years ago when somebody at our Wyoming Department of Health said, hey, you should go check this out, because she knew that I had been doing a lot with genetics, and I've kind of been off and on, just crazy life. And so I'm excited to be here.
Oh, we're glad you're here. And we totally get the off and on at Mountain States. So you never have to apologize about that. Thank you. Thanks for joining us today. And I've got Kay. I don't know if you're at work, Kay, if you can introduce yourself or not.
Hi, it's Kay Kelly. I'm in Colorado as well. I'm a newborn screening advocate, and I have a son with MCAD.
Great. And you were also a speaker at our Genetic Summit. So thanks for joining us today.
Thanks.
And I've got Rosie. I know, Rosie, you would just want to listen in, but will you give us a little introduction so everybody knows who you are?
Okay, I'll try to be quick. I'm Rosie Peterson, and I'm the Director of Institutional Diversity Initiatives at UT Dallas. I'm originally from Mobile, Alabama, where I worked as a community director for 18 years. I also worked with the University of South comprehensive. And that's where I met Dr. Hassel. So I served on some of the committees there in Colorado. So I haven't been to a meeting in several years. I was talking earlier about me being the director of the Association's board. I was the chairman. And after serving on that for some years, I got a little burned out, so I took a break. And I saw this, I got this email, and I said, well, let me find out what the Genetic Ambassadors is all about.
Great. We're glad you joined us today. You broke up a little bit, so I'm just going to fill in the gap since you and I talked before this call. You were on the board of the sickle cell, right? Sickle cell?
Yes. No, the Sickle Cell Disease Association of America, the
Disease
National
Association of America. Okay, perfect. Yeah, it broke up just a little bit there. Perfect. Well, we're glad you're here today, and feel free to just listen and we're glad you're here. Michaela, are you there? Maybe not. Michaela, can you hear us? I think you're on mute if you're trying to talk. Okay, we'll skip over Michaela and we'll come back. Heather, can you introduce yourself?
Hi, yeah, I'm Heather Schichtel. I run a nonprofit here in Colorado called Miracles for Mito. We support families in the Rocky Mountain region with mitochondrial disease. My daughter had a POLG1 deviation, and that deviation actually runs through our family. My brother has an adult onset mitochondrial disease because of that deviation. So that's why I'm here. I was a scholarship recipient at the conference, and I'm super excited to see how we all work together to think genetics.
Absolutely. I love that. Think genetics. Thanks, Heather. We're glad you're here.
Thanks.
Heidi, can you introduce yourself? I know you're at work, I think, but can you talk? No? She's shaking her head. Okay, we'll skip over. Heidi's from Utah, and she's our Utah co-lead for our Utah State team. I see Texas Parent to Parent. Who's that? I can't make it out.
Melissa.
Hi, Melissa. Can you introduce yourself?
Oh, sorry.
Okay. That's okay. Do you need to grab it?
No, I need to unplug it. Somebody else's office.
Okay.
Anyway,
Hey, Christy.
Yep.
Michaela sent an email to everybody saying that she tried to talk, but her computer and tried to call in on the phone, but isn't sure why anyone can't hear her.
Okay. No worries. Thank you. Thank you, Michaela. Go ahead, Melissa.
Okay, I am Melissa Fox. I am on the Texas members, one of the Texas members. I have a 28-year-old son with Down syndrome. I work at Texas Parent to Parent. We help families across the state of Texas find what resources they need, whether it's that one-on-one parent connection with a new diagnosis or maybe a new medication or procedures or behavior. It doesn't stop with the diagnosis. Sometimes we just need to connect with other parents, maybe find resources in their area that they need. I tell families a lot of times they can get a lot of the same information from professionals, but there's nothing really like hearing it from somebody who's lived it.
Absolutely. Thank you so much. I'm glad you're here today. And Daphne, I know you're calling in and you said you were going to be teaching, so I don't know if you're just listening in, but Daphne, if you can introduce yourself. If not, we'll go on. Daphne's from Texas. Oh, hi. Can you hear us?
Yeah, quickly. Actually, my class isn't until 2. Schedules got kind of moved around.
Okay,
but
no worries.
I have a grandson with vascular EDS, and that's how I got involved with this. Anyway, I don't know what else to say, but yeah, we're good.
Perfect, thanks. And Casey, I saw your name pop up. Are you on? Casey's phone.
Hey, Christy. Can you hear me?
Hey, Casey.
Okay, I just unmuted. Hi, guys. I'm Casey Singletary. I'm in Austin, Texas, and I'm the mom of a teenage son with classical phenylketonuria. And my husband and I were very active in Louisiana with advocacy and on a national level. We started a nonprofit there that's in the southeastern region of the Metabolic Collaborative. So I just recently joined the Texas team, and I'm doing some advocacy in this direction to try and better my understanding of how Mountain States does it. So Christy and I have just become acquainted, and I went to the meeting in San Antonio and learned a lot, and I'm looking forward to working with all of you.
Perfect. Thanks for joining us, Casey. And
thanks, Christy.
And Debbie Bridge, I saw that you joined. Debbie.
Hello, everyone. Hello, my name is Debbie Bridge. I'm from Austin, Texas, and my affiliation with this group is I am the project lead or a project manager for a website that's a statewide website, Navigate Life Texas. It's a website that was built for parents with children that has special health care needs, parents. It was written for parents by parents.
Perfect. We're glad you're here. Thank you. And you have a parent. You have a parent connection too, right?
Yes. I have a son also that's on the autism spectrum. Yes.
Gotcha. We're glad you're here with both roles. So thank you. And then Jen Bana, I saw pop up. Jen, are you on? Oh, are you on mute, Jen? We can't hear you.
Yes, I was muted. Sorry.
There you are. You got it.
I'm Jen. I'm from Montana. I'm the assistant team lead here, and I have a child with Pitt-Hopkins syndrome who is about to turn 19.
Perfect. And we have a bunch of phone numbers listed, like 3 or 4 of them, but that sometimes is duplicate. People are on phone and computer. So is there anyone that I didn't call on that would like to introduce themselves that's calling in by phone and I can't see their name?
I can. Tracy Keller.
Hey, Tracy.
Hey, I am the co-lead for the Colorado team and getting ready to start the Colorado consumer group. I have a almost 18-year-old who was born with a cleft palate and a bunch of other birth defects. So that's how I started in genetics, but I don't even think the internet was around back then, hardly. And then kind of took a break from healthcare, and we had a daughter that failed the newborn screen for a fatty acid oxidation disorder, so we were kind of thrown back into genetics, and I got connected with a bunch of families that way and kind of became a navigator just by default because I'm a nurse, my husband's a physician, and we understood the world and realized that most people, it's a very complicated world to navigate. So that's how I got started, met Christy, and got involved with Mountain States, and it's kind of just ballooned from there.
Awesome. We're so glad to have you. Thanks for joining us, Tracy. Anyone else that I missed?
Hey, Christy, this is Stephanie Aurora. I'm from Arizona.
Stephanie. Yeah, hey, Stephanie.
Hi, sorry we weren't able to connect sooner.
No worries. We'll make that call happen, but go ahead, introduce yourself.
So I'm from Arizona. I had a 25-year-old son pass away a couple years ago. He was diagnosed with long QT. So learning a little bit about advocacy and hopefully getting something done with newborn screening in that space. So I'm basically here to learn too, but see also where I can help out.
Great. And I think you came to one of our meetings in our last grant cycle. I think we met, right? In person. You came to one of our annual meetings.
I did. I missed the last one because it was around the anniversary date, and otherwise I would have been.
No, yeah. I'm glad you're with us today. All right. Anyone else on the line, on the call? We're good? All right. Well, I'm Christy Weiss, and I am the Consumer Engagement Director here at Mountain States and also do the social media. And I'm just going to, can everybody see my screen? I've shared my screen for those of you that are on the computer. Anyone can see that?
I can see it.
You can see it. Okay, thanks, Annette. I appreciate it. Just want to make sure I did click the right thing. Okay, so I'm Christy. As I said, I've been working with Mountain States since about 2012. My daughter has a suspected mitochondrial disease, and my background's in chemistry. That's what I went to school for. But the other hat I wear is I also do a patient advocacy through my own company at empoweredadvocacy.com. And what I just prepared this presentation just as a quick snippet of what we talked about last time because we have some new folks joining us. So for those of you that were on our call in November, I don't want to belabor this, but I just want to have all the information for everybody joining us today. Most everyone on the call I think is familiar with Mountain States Regional Genetics Network, but just to ensure everyone knows our mission. It's to ensure that individuals with genetic disorders and their families have access to quality care and appropriate genetic expertise and information through facilitating a professional network, this is a mouthful, of genetics clinics, key primary care practices, consumer advocates, that's all of you on this call, and state health department resources. And we're funded by HRSA, Health and Human Services, and we are in the smack dab middle of our 3-year grant cycle, which will end up in May of 2020. So we talked a little bit about the Genetic Ambassador Program in November and launched it then. And if you want more in-depth detail on that, I recorded that call and it's up on our website. But I thought I would just go over briefly. Genetic ambassadors are any consumers of genetic services, parents, family members, family leaders in our states that our region covers, which is Arizona, Colorado, Montana, Nevada, New Mexico, Texas, Utah, and Wyoming. I was looking at our list. I think we have every state represented on this call. Maybe, I don't know if we have anyone from New Mexico on, but we're close to full representation here today. And just to summarize, what does a genetic ambassador do? This is really just a program that we built within Mountain States to help promote genetic awareness and access to genetics care. And participation can include any or all of these activities. So you've heard some people talk about serving on their state teams. We have teams in every one of our states in our region, and so we have members on those state teams. The state teams don't have unlimited spots, so if you're interested in serving on your state team, check with me first, and I can let you know if they're recruiting consumers right now for their state team. We also use consumers in many of our projects, from the Underserved Populations Project, Developmental Delay Project. I'll share a little bit about it here in a second, and a ton of projects across our region. We also, if you want to serve a role as a genetic ambassador and you're like, I'm a kind of behind the scenes kind of person, we look for assistance with awareness outreach virtually through social media, website sharing of resources, and that's a way you can participate as a genetic ambassador. And then last but not least, we are going to be launching our genetics pop-up, where you can get involved in your local community, sharing information and resources. And that's coming. I'm working on the details of it, probably after our meeting. We're having a small state team meeting in Austin on Valentine's Day, so probably after that we'll finalize the details on that. But I wanted to tell you guys just 2 things real quickly that are new at Mountain States just in the last couple months. And at the end of this, I'll switch over to the website and show you how you can find this first one. So Mountain States has developed a developmental delay algorithm and associated resources and genetic resources. And what that means, this came out of our UPP project, which is our Underserved Populations Project, and talking with different geneticists around the country around our region in underserved areas. We found that one of the highest referrals to genetics clinic, specifically in our San Antonio area, was for developmental delays. And they have a very long waiting list, just in general for the geneticists that work there. And so the idea was that if we could we could develop a tool that pediatricians and primary care doctors could use to start the workup on those children that had been identified with a developmental delay, start the genetics workup, that it would really help facilitate access to care to the geneticist, because some of that testing that you might wait on a waiting list, and then the first appointment is some of that testing. If some of that testing could be pushed back to before that waiting list time, that it would allow the geneticist to help and be a consultant to the pediatrician, and then see the patient if it still needs to be seen and further genetics service and access. So that has been developed. It's been developed by a multidisciplinary team in the region, and out of that there was a lot of requests by some of the pediatricians we were sharing it with, that they wanted more genetics resources for their families. They maybe didn't feel super comfortable talking about genetics with families because it's not their field of expertise. And so out of that, I call it the toolkit, the developmental delay toolkit, because there's so many things now that have come alongside this algorithm, and I'll share with you where you can find all those links on the website so you can take a look at that. But the reason I'm telling you guys this is because even though we're sharing this with pediatricians and geneticists in each state, I really believe in the power of the parents and the power of information to parents who are looking for answers. And so I encourage you to take a look at this and share it with your spheres of influence and your parents, because you never know what parent it's going to reach that says, wow, we haven't even discussed this with our pediatrician, and they might take it to their pediatrician and start the conversation. And that grassroots approach, if you will, is going to reach more pediatricians than all of us at Mountain States working 40 hours a week, calling every pediatrician in our region, right? That one-on-one approach of a parent having that discussion with the practitioner can be really impactful. And then the other thing that's going on, and we just launched this on yesterday, is we are doing Facebook Lives to answer your genetic questions. And we did a survey in October and got about 88 responses, thanks to everyone on the call who shared it, because I know many of you out there shared it in your groups. And we got a ton of questions that people want to know answers to. So we're now recording Facebook Lives with individuals in our region to answer those questions. And the first one, I'm excited to say, was Heidi Wallace, who's on the call with us today. And it was a consumer advocacy question. And if you missed it, I'm going to encourage you to go to Facebook and take a look at it. And then I'm going to ask you, please, please, please share it in your groups, because it's great to be on the Facebook page for Mountain States, but we would love for it to be, to go further than that. We'd love for it to reach people that need these answers. And the question that she answered was, how do you get a researcher involved in looking for treatments for genetic conditions? And she did a great job answering it. So be sure and check out Heidi's Facebook Live answer. The other thing that we launched in November was our Genetic Ambassador Facebook group. And I've been adding people, but I want to make sure I haven't missed anybody. So if you wanted to be in the Facebook group and sent me an email, I have to actually invite you through Facebook. So if you see there, it says add members, and there's a little box and it says enter name or email address. I have to put your email address, and then Facebook sends you an invite. So sometimes that gets lost in spam. If I'm friends with you on Facebook, I can add you pretty easily. So just work with me offline and send me an email, and I'll get you in the group if I haven't done so already. I think we're up to, this is an old screenshot. This is when I just had Jamie in there to test it out. But we have, I think, 18 or 19 members in there now. So thank you. Okay, and then two other things I've already mentioned, our Mountain States Facebook page, but that's where you can find the Facebook Live. And then we also have a Twitter account, which is Genetic MTN State on Twitter. So please check out those two things. And then, of course, our website. And I'm going to switch over here. Let me stop sharing that. And I'm going to switch over here to the website. Hang on, if I can do this. Where's my share? There we go, share. I'm going to switch over to our website just so I can show you where those resources are. Can everybody see the website on their screen? You see it? Annette, can you see that?
Yes.
Okay, perfect.
Yes.
All right, so this is the homepage of the Mountain States website. And over here under projects, do you see the projects tab here? Under current projects, you can click that and you will see developmental delay algorithm and genetic resources for pediatricians and primary care. That's a mouthful, so we just refer to it as a developmental delay algorithm. But if you click that, it will take you into what I call the toolkit. And so there's a ton of stuff here. The algorithm is at the top and some supporting documents for that. Then you can see some of the pediatricians had questions about informed consent. How do you do informed consent for genetic testing? The laws pertaining to genetic information. And then down below that, there's handouts for families regarding genetic topics. Some of these are very general, so to be used on that first conversation with the family. We have some of them translated into Spanish, thanks to our partnership with Heartland. They helped us with some, they have some that we've shared. And then down below, there's webinars that have been produced, mostly for pediatricians and primary care in mind. But again, if you have a family that is pursuing this route or wants to learn more, these are open for anyone to listen to. So there's everything from chromosome microarray. There's been some IHS, Indian Health Service grand rounds where Dr. Larson talked about genetic testing, nutritional management of genetic conditions. And then this last one, Trish Thomas, our New Mexico state team co-lead, did a parent perspective with Dr. K on working with families to obtain genetic testing. So I just wanted to show you a snapshot of that and where you could find it. And each one of these is a PDF, so you can click on them, like for instance, genetics overview, and it opens right up in your browser, and you can print it from there, you can share it from there. It's pretty easy to navigate. Okay, I'm gonna stop sharing that screen. And I'm going to switch. I'm going to take a pause here and ask if anybody has any questions on what I just went over before I switch screens. Anyone have any questions? Or type them in the question box if your phone's not working. Nope. All right, you guys are a quiet bunch today. All right, I'm going to switch gears then and go over to our Serving on Groups training. Whoops, something just fell off my desk. Okay, I'm gonna go over to our Serving on Groups training. Let me switch over to that. All right, and there we go. Can you see that full screen? Can everybody see my Serving on Groups slide there?
Yes.
All right, thank you. Thanks, Annette, I appreciate it. So this is our continuation. This is the Serving on Groups training as a curriculum that Family Voices put together. And we started this at our Genetics Summit in person. We did modules 1 and 2. So for those of you that attended, you got a fancy little book that's spiral bound that has this whole curriculum in it. And we have extras of these books. So if there's anyone on the call today that would like to have that, you can go ahead and email me and I can get that to you. So the Serving on Groups training, like I said, is started by Family Voices, and we are on module 4 today. It's 8 modules, and we'll be doing the rest of them on these genetic ambassador calls, hoping to finish up around May. And the one that we're going to talk about today is called Tools Groups Use. So this is section 4, Tools Groups Use. And this really talks about the whole purpose of this whole curriculum is to allow consumers, family advocates, family leaders to get involved with groups that are decision-making groups. So groups that might be at your local level, your state level, or the federal level, and to be that voice for families, for consumers, for self-advocates, to be that voice and be able to participate as a member of that group, of that decision-making group. So we'll start off by kind of just outlining what are some helpful tools that groups use, and we'll go into more detail on all of these. But these are just some of them. Having a meeting facilitator, leader is really helpful. Some ground rules, an agenda, meeting minutes, written guidance, and then open and closed sessions and what the difference is between those. So if you've been in a group or in a meeting, it's really helpful to kind of have that person that keeps the discussion on track, right? That keeps it's a little bit of a timekeeper and a taskmaster, but they try to keep everybody on task. And this is really important, I think, is if you're ever been in that position, it's really important to make sure that everybody's able to share, right? That somebody's not sitting over in the corner and feeling like they can't get a word in edgewise. So really being cognizant of making sure everybody's voice is heard. And that meeting facilitator also really needs to be cognizant and be aware of the ground rules. And those are usually determined by the group as a whole. But it's those things that creates an atmosphere where people can share, right? Where people don't feel like their ideas don't matter. We want an open atmosphere where people can really open up and share what's on their mind. And some of those ground rules in the spiral bound notebook, some of those could be things like start and end on time, put cell phones on silent or vibrate, everyone gets a chance to speak. Side conversations are discouraged. Just some of those things that we're all going to agree to as a group to be in agreement on, so that we all can get to the task at hand. So the next tool that groups use are agendas, and I probably, for those that have served on groups, you've seen these before. But really, if you're new to groups, or you haven't been on a decision-making group, agenda, all that is really the roadmap for the meeting. It's important to only include those items that are going to be discussed at the meeting, and not like side conversations or things that maybe can be taken offline, don't need to be discussed by the group. And it's usually created by that leader or executive committee. And I like how they describe these kind of 3 parts of the agenda: the opening, the discussion and the decisions, and then the conclusion, kind of like a 3-act play, right? You got the opening act, you got the meat of the play, and then you've got the grand finale. So the opening is, just what we did today. I didn't have an agenda for today, but in the agenda in my head is that we were going to introduce participants. I was going to talk about genetic ambassadors. We were going to do serving on group training, and then we were going to conclude. So that introduction of participants, I think, is really important to have, especially if the group is coming together for the first time. That sets the tone and the pace. And sometimes on that first thing on the agenda, it might be, if you've met before, you might be reviewing and approving the agenda and the minutes from the previous meeting. And so that's sometimes a very important thing to start off the meeting with, an agenda with. The center section is that discussion and decision. It's the real meat of the meeting, and that is where everybody can have discussions and old and new business, making decisions that need to be made, that feedback, and of course keeping on task with those ground rules that we talked about. And the conclusion are those next steps. What are we going to do at our next meeting, or what are we going to do between this meeting and the next meeting, which would be some homework for the group. Then there can be announcements, and then sometimes you do a formal evaluation or a informal evaluation of how the meeting went, or tracking any data that you need to take from the meeting. All right, and we do this within Mountain States. Annette is awesome at this, is following up with meeting minutes. And this is really important because this is a summary of the meeting. All of our state teams meet, and Annette puts together meeting minutes that summarizes what did we talk about. It's a record of decisions and then action items. It's typed up and distributed to the members of the group. And previous meeting minutes, like I said, with that agenda, that sometimes certain decision-making groups start with that by saying, let's make sure that we are in agreement on what was in the minutes. So there's an approval of the minutes at the following meeting. And I love this reminder because it's a good one. Still take your own notes, right? Don't be dependent that it's going to be in the minutes, because something that might stick out to you might not, the person that's taking the minutes, it might not be captured because it might not be as relevant to them. So it's good to still take your own notes. All right, and this is just a slide on meeting time management, and I'm watching our time here today. But being cognizant of the time and being respectful of everybody's time. And if the meetings continue to run over, this might be a time when you, as a family member, especially the busy family members that we have in the Mountain States and on this call, to step up and ask, hey, is the agenda too full? Maybe we're trying to cover too much. Do the ground rules need to be established, or do they need to be enforced? And maybe there needs to be a timekeeper to keep everybody on task. Maybe the leader is great at opening discussion, but maybe they're not the best timekeeper, so you need somebody else to have that role. And maybe we need a 2-hour meeting instead of a 1-hour meeting, right? Maybe we just need more time to scheduled for the meetings. But this is where hopefully when you're in a situation that you're serving on a group, that this information can empower you as a family, that you're an equal member of that team, and your time is valuable too. Even I know sometimes when I've been on groups, sometimes we think, oh, I'm just the mom. No, we're not just the mom. Our time is valuable as well, because we have tasks we need to do for our kids or get done for, and so we need to value our time as well. So making sure that, and everybody's time on the group should be valued. Okay, and then this last part is called written guidance, and this is for what I would call more formalized groups, maybe at the state and federal level, but it helps individuals interact with the group. Written guidance would be things like bylaws, policies, procedures and protocols, or compacts. And these, usually when you are asked to be part of a group that's a decision-making group, you would be given a copy of these. And if you're not, I found sometimes I've been on a group and I've realized, oh, there's policies in place that I didn't know about. And then being empowered to ask for a copy of those, because gosh, it's like nothing is harder than trying to follow the rules without knowing what the rules are, right? And without knowing what those policies and procedures are. So don't ever hesitate to ask if those are available. If somebody, invited you to a group, but maybe forgot to tell you, hey, we've got some policies in place. This last slide, or the last section, talks about open versus closed meetings. And I think I know I see this a lot at my county level. For instance, we have a Board of Health that meets here that I attend sometimes, and they have different kinds of meetings. They have open meetings and closed meetings. So the open meetings are open to anyone I mean, anybody, whether they're in the county or whether they're in the state, but anyone can come to those meetings, and they have a public agenda that's posted 2 days before the meeting on the website, so anyone can be notified or can know about that meeting and attend. The public is usually invited to listen to the group's discussion, so it's not one where maybe they're actively participating in the discussion, but then there's usually a public comment period to many of these meetings, and so the public may share their views on topics, and that's where you have to kind of ask about the rules of the group or the public, the guidance on that, whether, and for instance, the Board of Health that I'm referring to gives a 3-minute public comment, and you can comment on things that are on agenda or off agenda. So you can really have a chance to speak your voice about different topics. But the difference would be with the closed sessions would be those are usually not open to anyone. They are used when the topics are not appropriate for non-members, and the things that would be discussed in a closed session would be maybe personnel issues that maybe we don't want to, have those kind of personal discussions in a public forum. And the other thing would be confidential information that probably shouldn't be shared in a public forum. So I love this slide, because I bet all of us have been part of a unproductive meeting before. Raise your hand. I don't think any meeting starts out, or any group starts out with the goal of being unproductive, but we know this can happen. And so see, these are some of the common reasons for unproductive meetings, which is participants aren't prepared. There's maybe no agenda in advance. The group doesn't follow the agenda or gets sidetracked with side conversations. Not everyone considers themselves participants, and I've seen this happen a lot with families and advocates, right? You kind of think, oh, I'm just here kind of listening, but I'm not really participating. But really, if you've been asked to serve on that group, if you've been asked to be a member of that group, you are a participant. And the other reasons could be data is lacking, or decisions made are not based on data. No action items are highlighted, and so therefore we meet again in a month or two, and nothing gets done because maybe there weren't any next steps or actions from the last time. No timelines and deadlines can be deadly, right? If you just kind of don't have any follow-up timelines or deadlines, and then again, no follow-ups. So we probably all are aware of these traps. Avoiding them can be much easier said than done. And last but not least, this slide is just the resources slide. One of these links, the first link, is broken, and so I reached out to the Serving On Groups trainers today, and they gave me another link to put in there. So what I'm going to do to make these easier is I will put a Section 4 post up in the Facebook group and link to all of these in the comments. So if you want to read some of these tips and tools, policies and procedures, and some of the training resources that go along with this one, I'll put those in the Facebook group so they're easy to just click on, and you don't have to write this all down. All right, so we are at 2:41. I'm going to stop sharing my screen here. There we go. We're at 2:41, and I just wanted to open the last part of this for a little bit of discussion. And I'm so excited about the participation we have in Mountain States with so many consumers, and just wanted to share your ideas on what else can we do within Mountain States as consumers. And Tracy, I don't want to put you on the spot, but since you're on, would you share what's going on in Colorado with your Colorado subgroup of consumers? Or do you want me to talk about it? I'm happy to talk about it.
No.
Go ahead.
Can you hear me?
Yep,
I unmuted myself.
I can hear you.
Okay.
Go ahead.
So we have our Colorado State group, which is made up of the providers, genetic counselors, physicians, family practice, and then consumers. And through the ambassadors and through just some other contacts, Christy was getting me more names of people who were interested in joining the state group, but unfortunately ours is done. We don't have any more space to take everybody for the main state group that are for consumers. And so, but I didn't want anyone turned away. So we're going to form a subgroup. We're going to form a consumer subgroup that will kind of meet independently, but share the same agenda, and then also add some of our own to kind of merge the two groups together without being one big, massive group. So it's brand new. We are excited to get it started and going. And then each month on the main state group, a slot on the agenda, as we were just talking about, is going to be slotted just for our consumer group so that we can get input going both directions. And so, you know, a lot of the projects that we do with the state group are actually things that we need consumer input on, and everyone brings such a different perspective. Everyone has different resources, different experiences, have hit different roadblocks, and I think all of them just make the group better. To have the more input, the better, because we all have just one little piece of the world that we see, but there's a lot out there that we don't see. So that's kind of, it's brand new. We'll probably have more information as it kind of gets going and we see, you know, what's working and what's not. But I don't know, Christy, do you have anything else to add?
Yeah, thank you, Tracy. That was a great overview, and you've got a lot of Colorado folks on the call today. So I know some of them you've been in contact with, but if I just wanted to say, if there's other Colorado consumers on the call that would like to get involved with that Colorado subgroup, I don't think Tracy's imagining it to be a huge time commitment, right? It's more probably virtual at first. Go ahead.
And also, it's I think one of the groups that I think gets left out a lot is the undiagnosed. People don't feel like they can be a part of these groups if they don't have a genetic diagnosis yet. And I think their input is probably going to be some of the most valuable, because it's a group that advocacy needs to target. And I mean, even at the physician conferences, big genetics conference that I attended, they know that there's a big void, and that we've got to get those people involved and feeling like their voices are being heard and that their needs are being met. So I'd plug that if you know someone who thinks their kid may, you know, even if it's just developmental delays, if they want to participate, they're more than welcome, whether they have a diagnosis or have even thought about, you know, heading towards the genetics area.
Great. Thank you, Tracy. That's awesome. Does anybody have any questions for Tracy or comments?
Well, I just want to say that there are adults who are in that situation. It's not just children, you know, that have genetic issues and they've never been diagnosed, and they probably, you know, could be, but they don't have any guidance as to how to find help or whatever. And so I'm very committed to that group too.
Well, and I know in Colorado, we've talked about it, because I would imagine, just as a little background, fatty acid oxidation it's on the newborn screen, and it's a very conclusive, it's easy to diagnose, but it's not, they used to think it was only severe forms, and now they're finding out that there's a lot of people where they thought that you couldn't have lived into adulthood with these mutations, they did. They just didn't get identified. So there is a very large number of adults that are being identified as CPT2 or even severe mutations of MCAD, and now they have nowhere to go because there's only pediatric geneticists who now have a 2-year wait list. So we've actually brought it up in our Colorado State meeting. How do we get, the needs of adults, whether they're diagnosed or not? That's definitely a group that needs to be targeted and made to feel like they have a place to turn to. So, we're working on it.
No, go ahead.
I was just going to say, this is Mallory Tracy. That's a very valid point, and I think it crosses over into the healthcare transition component, which I've done a lot on, and I know Colorado is very involved in too. Aside from that, I'm wondering if you could give some examples of projects or things that the state group is working on. This is the first I'm hearing about it, and I'm very involved in systems in Colorado.
I'm not sure if I understood your question.
So,
you mean,
so I think he's
asking, what does the group do, Christy?
Well, you're talking about the Colorado subgroup, the consumer subgroup, right?
Or the subgroup, or just the genetic state groups in general, but this one specifically.
Gotcha. I can give an overview of the state teams. Yeah. So the state teams were set up in this grant cycle in place of our work groups in the last grant cycle. So in the last grant cycle, we had like consumer advocacy work group, we had newborn screening work group, we had emergency preparedness work group, and they were multi-state teams, right? They were any state could be on that work group. And so in this grant cycle, instead of having a work group structure, we don't have that anymore in Mountain States. And so now each state has a group of geneticists, public health individuals, consumers, genetic counselors that usually about 5 to 7 people, 5 to 10 maybe, are on each state team, and they're working on access to care. So how do we get underserved patients access to care in Colorado, in Utah, in Nevada? And each state is deciding how they're going to do that based on what they know about their state. So for instance, I'll turn it over to Tracy. So for instance, Colorado is working on ECHO project, a Colorado ECHO project. For those of you that don't know what ECHO is, it's a way for doctors to get education, not just education, but also case consults with other doctors using telehealth, telemedicine, technology, so they don't have to be in the same room together. But they've also done, Tracy can speak more to this, but they've also done some work on navigation of resources they're working on for the website, and then also talking about consumer support groups and consumer acronym directories, just trying to make this easier for families to navigate within Colorado. Do you want to talk more about some of those projects, Tracy?
Yeah, I mean, we're kind of early on, we were looking, one of the biggest needs is a lot of people, especially someone moves into the state, what are they looking for? One of the hardest things was navigating the Medicaid waiver, the special needs healthcare access. And so we redid the flow chart on it to just kind of make it so that families can see who qualifies, what's the process, who's my next contact person. So some of it's taking programs that were already there and just making them a little bit more user friendly so that people who are new to the area or new to having a special needs child can navigate it a little bit more easily through our website. And then one of the families in our group is Spanish speaking, and so one of our projects in the fall was attending a Hispanic conference with a genetics table there, so that families there could just walk around the conference, and if they had questions, there was a contact person to kind of say, hey, what do you think about this? And we're part of one of our projects moving forward is also to get involved. Christy, is it 9 health?
Yeah, 9 health fairs. Is that it?
Yeah, trying to look into getting a table at the health fairs so that if people are walking by, genetics is in the news more with 23andMe and stuff like that. So whether it's questions about does carrier status matter, just any questions that the general public and people who have specific concerns, whether they're children or adults, have a person to talk to and where to turn to for more information. So we're going to look into getting tables and representation at some of those health fairs and stuff. So that's kind of what we're working on. And then there's always, we're always looking ahead to our next project, and that's kind of where the consumer group will come in. So if someone identifies a huge need, then we can take it to the group and say, hey, what do we think about launching a project that targets this or works towards that, and just getting different perspectives to try to get it into action.
And just so you know, Mallory, all the states have different projects. So for instance, Utah is working on taking that developmental delay algorithm that I showed you guys, and they're customizing it towards Utah and identifying their underserved population as those with developmental delays. And so they're working with pediatrician offices, and that's their project. So it's
yeah, that
very
makes
specific.
sense.
Say again?
I said that makes sense.
Yeah, so each state's kind of deciding where their needs are, each state team, I should say. And so we would welcome your input. Would love to connect you with Tracy. I don't know, maybe you guys are already connected for the consumer subgroup if you're interested in that. And I know you and I our calls keep getting rescheduled, but let's connect on the Medicaid stuff as well.
Okay. Yeah, that sounds great. I actually was involved in the pilot for Project Echo. And presented, so I didn't know that you were connected.
Well, maybe you can help them out, because I think they're stuck right now. Or they said last I heard they were waiting for some funding. Echo was waiting for some funding, right, Tracy? I think that was the last status.
Yes. Stefan's going to give them like another 2 more days, and then he's going to hound them again.
And then he's contacted them. Great.
Okay. Thank you. That was helpful.
Yeah, no worries. All right, so we're coming up on the top of the hour. I just wanted to see if there's any other questions. Is there anyone on here that needs to be added to the Facebook group, or would like to be, I shouldn't say needs to be, but would like to be added to the Facebook group? Just send me an email, or I'm looking over on the comments and make sure I didn't miss anybody over there. But if you're not already in there, and those that are on there, are you seeing the post? Is everybody seeing that? I'm trying to put stuff in there, not flood you with everything that's already on the Mountain States Facebook page, but if there's something like, okay, the Facebook Live's gone live, can you guys help us out? I'm trying to put things that are relevant in there. And I did want to point everybody's attention to, I just posted it today, but there is a call out for speaking of serving on groups, there's a serving on groups opportunity nationally for individuals that have been identified through Newborn Screen and who have maybe had a false positive on Newborn Screen. It's a newborn screening group being put together federally, and I put the details on that on the Facebook page, but I just wanted to point it out to you guys today because the deadline for it is February 1st, which is Friday, no, not next Friday. So it's coming up quickly for applications or for people that might be interested in that. So if you know any families or you yourself might be interested, I have a long email with much more information on it, but I kind of condensed it to put on Facebook. So the precursory details are on Facebook, but I have much more I can share with you if you're interested.
Hey, Christy, I don't mean to belabor the call with this. This is Stephanie. Could you send that email to me since I'm not on the page yet and that's such a short deadline?
Yeah, absolutely. Yep, no problem, Stephanie. I think I have your, remind me, your email's the one with the number or not with the number?
With the number.
With the number, okay.
Thank you.
Gotcha. Okay, gotcha. Stephanie, Newborn Screen. Yep, I'll send it after this call. All right.
And then,
well, thanks. Go ahead.
It's Tracy. Can you share my email address with Mallory so she can get onto our get information on the consumer group for Colorado?
Yep, I'll do an email introduction with you guys. Is that okay,
Thank
Mallory?
you.
Is Mallory still on there? Okay, I think Mallory might have jumped off. I'll do
That's
an email.
fine. You can just give her mine and then she can contact me back.
Perfect. Perfect. Great. Anyone else have anything before we sign off? Are these calls helpful for you all? Like, is it something, I know this is only our second one, but would it, my plan was to do these monthly. Is that good for everybody? That frequency, once a month, kind of get together and kind of touch base of what's going on in the Mountain States?
Yes.
Yeah? Okay.
Yeah, that works.
Okay. Is everybody good with the dual format? I have to get we're trying to complete that serving on groups training by the end of this grant year. So I hope you don't mind. We kind of do a dual call. We do some Mountain State stuff, some training as well.
No, that's good.
Good. If anybody wants this, I'm going to show you. I wasn't on camera before, but if anybody wants one of these serving on groups manuals, just send me an email, and we're happy to put one. Annette's got them in the office in Austin, so she can put one in the mail to you. This is what it looks like, and it's got all these tabs, one for each module. And this was originally put together from an educational perspective, but in Wisconsin is where the original training came out of. But I love because it has resources, and it has an example of everything in it. So it's a really great, if nothing else, it's great to have on hand. You might already be serving on groups, and so some of this stuff might be seem elementary, but this is great to use with new families. If you're connected with a new family and you want to bring them into a group you're already serving on, this could be a great resource. So hopefully, we like I said, we have extras of those. So I would love it to be in the hands of our consumers. So if anybody would like one of those and didn't get one at our Genetic Summit, let us know. Okay. All right. Well, it is wonderful to see everybody. I love that we get Zoom and we can see faces. It's good to see everybody. And I'm going to sign off from this end, and we'll talk to you all soon. I'll be looking for probably a meeting towards the last 2 weeks of February for our February call. I don't have a date picked yet, but I'll get that on the calendar here soon.
Thanks, Christy.
Okay. All right. See you guys later. Bye-bye.
Bye.
Bye.